Hi, my name is Dr. Ron Henry and welcome to Acupuncture Meridians 5. What is an acupuncture treatment like? Of course, the best known way of doing acupuncture is just that, puncturing of the skin with a needle, which is where the name acupuncture comes from. But considering that at least half of the population, at least in the US, has a fear of needles, we must consider other ways of performing meridian therapy that do not involve puncturing of the skin, and therefore carry no risk of pain or infection. Although an experienced acupuncturist who is familiar with the precise location of the points and method of application can treat safely and painlessly if they choose, there may still be sensations brought about during a session. These include feelings of fullness or awareness of maybe a rush along the course of a channel. This is what the Chinese call Tai Chi, or hitting the energy. And it was believed that this represented a release of the blocked qi, convinced that when the needle was placed in the right point and in the right way, it could often produce an almost instantaneous release and opening of this vital force. Nowadays, we have the option of more contemporary methods of performing needle-less acupuncture, ones that no longer even require needles. These include, for instance, the use of Tai Shin. And Tai Shin is used for tapping a point long enough to get it to release, and no needle is involved. It's actually more like shiatsu, pressure point therapy applied to a specific point until the energy blockage is released and flowing again. There's also electrical point stimulation, which uses a current applied very gently and is usually quite comfortable, using only very light stimulation, and sometimes as an alternating current of positive and negative, applied at very gentle levels. And this can help an acupuncture point to release as well. But an up-and-coming method of point stimulation and another pain-free and infection-free way of applying meridian therapy is the use of therapeutic lasers. In this case, laser is used as a focused beam of non-damaging, coherent light onto a specific point, just as we might treat with a needle, but in this case, no needles are involved. Instead, we're using a laser to stimulate both the molecular level of the physical tissues, but also the energetic level, which is what the meridian system is. This activates both the mitochondria of the cells, as in physiotherapy, but also the acupuncture points of the energetic meridian system, similar to traditional acupuncture. Mitochondria are the source of biological energy within a cell, and they actually contain chemical compounds called chromophores, which are able to respond to and absorb photons coming from lasers in the form of coherent light. For the most part, this benefit appears to hold true no matter what type of cell is being lasered, whether it's a muscle, a ligament or bone cell, or an organ cell such as the kidney or liver, or even a brain cell located within the skull. It appears that they all have the potential to be benefited by laser in ways that we are still discovering. There's no doubt that we will continue to uncover many other ways to stimulate these acupuncture points, including, and this will be for researchers of the future to reveal, perhaps even color and sound. The methods we use in our office are primarily needle and laser, because these are generally the most effective in treating the patients that we see at our office.